Live streaming is on.
What? Piece of shit.
Okay. Good evening, everyone. We call the meeting to order.
Dr. Whitman?
Here.
Andy Dennison?
Present.
Ben Vitale?
Here.
Chris Petrie?
Here.
Paul Pickney?
Here.
Keith Batman?
Here.
Hans Fetcher?
Here.
Charlie Ripley?
Present.
Heidi Nightingale?
Present.
Elaine Daly? Here. Tricia Pearl?
Here.
Timothy Lattimore?
Here.
Michael Video?
Here.
Ryan Foley? Lee McBath Coleman?
Present. We stand for the pledge. I pledge allegiance to the flag of the United States of America,
United
to the republic for which it stands,
States. Under God,
indivisible,
indivisible, with liberty and justice for all.
stand for a moment of silence. Thank you.
Our sincere condolences for family and friends of Francis Scott Bennett, former Cayuga County Supervisor and legislator. He also served in the United States Army. The body goes to Bennett. Proclamation. We've already presented the domestic violence awareness month in Cayuga County, October 2020.
I'd like to ask the sheriff to come up and present a proclamation. Sheriff, in Cayuga County. Whereas the office of sheriff has been an integral part of the criminal justice system in New York State and in Cayuga County throughout, having been established in the state's first constitution in 1777, and having continued in every succeeding constitution, and having been one of the original constitutional offices of Cayuga County, first established in 1799. And whereas the Office of Sheriff has evolved into a modern, full-service law enforcement and public safety agency, manned by fully trained police and peace officers, as well as civilians using state-of-the-art technology and applying the latest, most advanced theories and practices in the criminal justice, civil process, corrections, and court and county office building security divisions. And whereas a constitutionally empowered entity directly responsible to the people, the ancient office of sheriff remains, even today, responsive to public safety needs. Now, therefore, be it resolved that I, Elaine McNabb Coleman, Chair of the Cayuga County Legislature, and fellow legislators, do hereby proclaim September 20th to 26th, 2020, as Sheriff's Week in Cayuga County.
Sure, just real quickly, I'd like to say thank you, Madam Chair, and certainly thank the legislature for this proclamation and for your support. And I'd just like to point out, as the proclamation indicates, since 1799, sheriffs and their deputies have provided public safety services in Cayuga County. And I'm proud to be here as your 59th sheriff after 58 who've come before me. But the office of sheriff, as the proclamation indicates, isn't just about me as an individual. It's about the sheriff's office as a whole and all of the men and women that do the work that we do on a daily basis, 365 days a year, 24/7. So I appreciate you recognizing the work that they do. I'm proud of the work that they do every day, and I can't wait to share this with everyone at the sheriff's office. So thank you very much.
Okay, up next, we have a presentation today by Insero.
Hello, everyone. Can you hear me okay?
Yes.
Okay, great. First, I want to take a couple minutes just to thank Jim and Mary Beth and all the staff of the Treasurer's Office, as well as all the departments that helped us during our audit. It was an unusual year with COVID and having to work mostly remotely. So folks had to upload and scan a lot of information for us. So I'm going to thank them for all their help. I think you should be really pleased with the results of this audit. We didn't have really any findings. We have one recommendation to make that has to do with reconciling departmental bank accounts. We're just recommending that the Treasurer's Office do that just to add a level of segregation of duties as well as promote some consistency in the process. But that was really the only finding that we had. So I think you should feel really good about that. So if you could advance the slide, please, Amanda. So the executive summary, and I can hear myself talking in the background. I hope it's coming through okay. Talks about all the different reports that we issue, and we'll talk about some of the numbers as well. So there's two parts of the audit that we do every year. The first is to audit the financial statements. So the AUD that Mary Beth prepares and submits to the state is the basis of our financial statements. So we've given you an unmodified opinion on those statements, and also connected with our audit of the financial statements is our internal control, our report on internal control over financial reporting and compliance in accordance with government auditing standards. So we had, as I had said, no findings, and we've given you unmodified opinions, which is the highest level of assurance that you can get on the financial statements. And the second part of the audit is our audit of the federal programs. So we didn't have any findings. This year we audited HEAP, Highway Planning and Construction, Adoption Assistance, and Homeland Security. Every year we do a risk assessment, and we decide, it's mainly of the larger programs, and we decide what we're going to test. So it varies, of course, from year to year. Okay, Amanda? So talking about the federal expenditures, you expended almost $23 million of federal money to support your programs. So that's quite a lot of federal dollars. Now, we also have several letters that we issue as a result of the audit. And the one that I'm going to talk about now is called Communication with Those Charged with Governance at the Conclusion of the Audit. And this letter is required every year. It's something that we need to communicate every year to you. So it probably looks very familiar. So under accounting practices, if there were new accounting practices, we would put that in the letter. There were none. There were no new accounting pronouncements that we needed to implement this year. Also under accounting practices is a statement that we have various estimates in the financial statements, things like depreciation expense and your retiree health insurance, your share of the pension liabilities. Those are all estimates. And then as far as corrected and uncorrected misstatements, we did have one adjustment that we needed to make this year that we put in the letter. And then other matters just talks about our responsibility with other information that is in the financial statements. So I'm going to take a minute just to ask if there are any questions about the audit process. All right. Now this year we did some department testing at the Sheriff's Office, and we looked at the commissary accounts, and I'm pleased to report that we had no issues with the result of that testing. Okay, we can go to the next. All right, so this is the general fund. So I'll just go briefly over the highlights of changes in the financial statements from year to year. So your assets were up about 5%. And most of that was in cash and investments. I should say there were a lot of investments in treasury bills and CDs. So there was like about 6.3 million in CDs and 8.5 million in treasuries, which, as we'll see in a minute, helped to generate more interest income for you this year, investment earnings. That was up as a result of operations, as well as the timing of receivables and payables. And then due from state and federal was up quite a bit. And there was no particular area where this was up. It was kind of across the board. Sales tax was up, receivables for mental health, DSS, but that was about a $2 million increase over last year. And then notes and loans receivables staying about the same, of course, different from 17 in that in 17 you had a receivable from the hospital for the hospital debt, and that was liquidated last year. And then we can go to the liability section. You want to advance the slide, Amanda?
There we go.
Whoop. There you go. So liabilities, as you can see, pretty much stayed the same. A little bit of movement within the categories, but pretty much the same. So we can just go to fund balance. And there you can see that your fund balance increased by a couple $1 million. And that's because you had excess revenues over expenses or expenditures during the year. We have several slides that go into the detail behind all these different categories, but you can see from last year, your restricted fund balance went up quite a lot. And that's because you funded capital reserves. And we'll see that in a minute. And then assigned was up a little bit because of extra encumbrances this year, which is a timing thing. And then when we look at the income statement, you can see that revenue is up about 3% over last year in real property taxes and tax items, as well as non-property taxes. State aid and federal aid were just a little bit under what it was last year, but roughly about the same. And then mainly that's departmental income that was up, as well as interest earnings. And then when we look at the expenditures, we can see that they're up also. But they were still within about 400,000 of the original budget. And so you had a net fund balance change of $2.5 million that you increased your fund balance. And then the next slide just looks at the fund balance in the other funds, the other governmental funds. So you can see County Road lost a little bit of money this year, about $660,000, and the other ones pretty much stayed fairly similar. Capital fund balance is just due to borrowing to fund capital projects, and will get reduced as you fund the projects. All right, so let's look at the components of fund balance in a little bit more detail. So here you can see the restricted fund balance is showing not quite $1 million in your building repair, and then about $4 million in each of building and highway. So you put that money away that you can do projects coming up. And then a little bit of money for the Stop DWI program. And then if we look at committed fund balance, that didn't change a whole lot from last year, but the big part of that is the reserve for the Sterling Nature Center that you committed to do. And then when we look at the assigned fund balance, we can see that you've got appropriations of almost $1 million to support the 2020 budget, encumbrances that are just under $1 million, and then some assignments for claims and liabilities and unemployment. So giving you, assigned fund balance of 3.3 million, which then leaves you at the next slide, the unassigned fund balance. So this is what is available to you to use. And it is within about 13% of the 2020 revenue budget. So that is within your fund balance policy. So are there any questions about any of the numbers, any of the fund balance numbers?
Question.
Legislator Lattimore has a question.
All righty.
Yes, did all the different departments report on time for this audit?
I'm sorry, can you repeat that? I had trouble hearing.
Did all the departments report on time for this audit?
Report on time.
Yes.
Well, we waited a little bit for DSS, but this year is very unusual. And I have to say that in general, I was very pleased with your readiness for the audit, given what you've had to go through with COVID and staffing issues and whatnot. So, yeah, I mean, I just have good things to say about everybody.
Now, since our fund balance is so good, is it a good time to go to Moody's and ask for a better credit rating? I know we improved it several years ago. And I'm just wondering whether we should ask again to get a better credit rating.
I don't know how COVID affects all this and whether that's probably a question that's probably better answered by your fiscal advisors. If it weren't for COVID, I would say probably yes. I think, with economic conditions in the county, your sales tax had been up. You were, it seems like it would be a good time, but I don't know in this environment. I think like I said, I'd want to ask your fiscal advisors about that.
And in regards to our federal aid, I know our governor is sitting at, 60 billion or something of federal aid. Are we expecting any more federal aid?
Well, I mean, you've got the 20% that they're withholding,
Okay.
and we just don't know what's going to happen with that. And a lot of that depends on what happens at the federal level as well. It is good that you've managed to put money aside. I know I have one county that I'm going to be talking to this week who is facing a $13 million deficit. They're not quite sure how they're going to cover that. So I think you're going to need that this year.
That was my final question. Of the counties you do, are we stand out in regards to having money versus not having money?
I think you're one of the healthier ones for your size. And I think you do a good job of managing that fund balance, and it is good that you have a fund balance policy. Not all of our counties do have policies about fund balance. So I think that's a very positive thing, because it means that you've thought about what you need to do to maintain a fund balance that'll protect your programs going forward.
Thank you.
Yep. Any other questions, comments? All right. Well, thank you very much for your time. And thanks again to everyone at the county that helped us with the audit.
Thank you for joining us this evening. I appreciate that.
Yes.
Hey, before we go on to the privilege of the floor, I've added a very brief update, COVID update by our health director, Kathleen Cuddy. Kathleen, I wonder if you can come up here and just to give us a few brief points. Thank you.
Hi, good evening, everybody. So a few updates for you. I had mentioned to our Board of Health, and some of you were listening in on the Board of Health today. Probably the last 3 weeks have been more stressful related to COVID than the first 3 months in many ways. You know, we were crazy busy the first few months, but I think particularly the last, I'll even say month, with the school guidance, with nursing home needs, with testing needs, have added a layer of stress and inconsistency. Right? There's absolutely it glaringly shows our health disparities within our communities, right, and within our region. So the K through 12, with schools opening, it is not a suggestion, but it is a mandate that if your child or your staff member goes home from school not feeling well, they cannot come back to school or to work until they have had healthcare providers' written assessment, a negative COVID test, and are symptom-free. Well, that's good in some ways, except that it's extraordinarily restrictive. And the ideal would be to give a little bit of leeway to the healthcare providers to help use their discretion, right? They may still encourage and require a COVID test depending on symptoms, but clearly if your kid has a sinus infection, you know, the antibiotic should take care of the issue, right? So just using that as an example. So there have been dozens and dozens of children sent home from school requiring tests and healthcare provider assessments, symptom resolution. In some ways, you say, great, if it's a child who has asthma, and I'm saying children, but it's the adults too. It forces their hand to have some interaction with their healthcare provider to try and get their symptoms under control. But there's a lot of limitation because of this. It's very frustrating. And the reason it's so frustrating in particular is because we've been hearing for the last month that New York State Department of Health has put forth some revisions, some edits to these requirements, and apparently they've been lost in limbo somewhere because that has not come through to us. And I am not one to bash the state, but I'm bashing the state on this one because it's unacceptable that this isn't to the localities at this point in time. Nursing home testing, it's great that there's going to be some opportunity for visitation. It's a long time coming, and it's great that we're being very cautious about it. One of the biggest obstacles for a visitor is the requirement that within, not only do you need to schedule your visit, but you are required to have a negative COVID test within 7 days of your visit. Again, all good ideas. Nobody wants to introduce any disease into our healthcare facilities. But that leads us right back to our lack of ample access, ample availability, quick turnaround, and the cost for testing. That is where I think our health disparity and the health inequities become the most glaring. You're hearing about lots of testing potentially done in some of the larger counties, but we're not getting it here. Now, that's not to say testing is not available. Testing is available. You can go to the urgent care centers, you can go to your healthcare providers, you can go out of county, and they can still perform your test. If you have health insurance, your health insurance will cover it if you have symptoms or if you're part of a public health investigation, but it will not cover it for surveillance purpose. So that would be exactly like your nursing home situation. So if you have health insurance that's going to pay for your COVID test, you want to go to visit your loved one in a nursing facility, your health insurance is not going to pay for it. So you need to pay out of pocket for it. And it's a minimum of $100. It's more in many places. And there's one urgent care center locally that charges at least $175 no matter what. They're not even trying to bill your insurance anymore because they got stiffed on insurance. That's what we're being told back in the more ample testing days. So they're cash only operation right now. So it's frustrating, right? But we are working, trying to get more testing for Cayuga County, right? We want the citizens of our community, we want you to know that we are working hard to try and get low cost, no cost testing for us. We're waiting. I was really hoping to have had affirmation before today's meeting, conversations with Upstate University to bring some testing here at least once a week, to be able to test 100 to 150 people, and that would be no charge testing. They will ask you for insurance because they certainly do want to bill it. However, it will not be a requirement. So there's a great opportunity for people. Again, I'm thinking of the nursing facilities, a great opportunity there, but it's also an opportunity for others. It would be nasopharyngeal, which kind of goes back to the types of testing available, because we know sometimes there's saliva testing available. We know sometimes there's just like oral and nasal versus nasopharyngeal, which is more intrusive. So we want to look at all of our options. We want to have more options. We want to have affordable options within our community. We're seeing our numbers start to creep up a little bit. As of yesterday, I believe we had 11 positives. And I don't even know the number of quarantined people. Some of these we've had some, you've heard some of the outbreaks that happened with our SUNY systems. So like Oneonta and Oswego. Not as much Oneonta, but certainly Oswego. We've got a number of students who go to school there. SUNY systems ideally will keep children and keep students who are positive and in quarantine. They will encourage them to stay put, which is the smart way to go, because you don't want to disperse potential infection out to the community. But it's not a mandate, right? So if you're under quarantine, and one of the schools we know says if you live within 30 miles and you want to go back to your place of your home residence, you can do so. It's a challenge for us as a local health department to get that information. It's not forthcoming with the systems that are currently in play, and that then translates. We know the sheriff can appreciate this, and others, as when COVID started out, as a health department, we said we would do our best to flag the addresses for 911 so that if there's a 911 call, the first responders will know that there may be someone in that household who's in isolation or quarantine. So just as a reminder to make sure that they are appropriately attired with their personal protective equipment. So we can't make promises that that's happening right now. We can only continue to do so with the information that we have. So it's been very frustrating, as you can tell. I want to encourage people to keep up their prevention and face covering. I like to see everybody wearing them. Mass gatherings. We've seen some pictures. We read the paper too. We don't want to see mass gatherings. That's the executive order saying not over 50 people, and keep your distance and wear your face covers, and that's not always happening. So I want to encourage all of you to walk the talk, right? And help keep our community with lower numbers, because it's a tremendous amount of work we're doing 7 days a week. So I guess that's my update for the moment.
Questions for Kathleen?
Could you clarify, Mr. Pinkney and I had a discussion before the meeting in regards to quarantine. It's 14 days.
Correct.
But you don't have to stay in the quarantine if you get a rapid.
Oh, yes, you have to stay in quarantine for 14 days. So quarantine happens, it's somewhat irrelevant whether you get tested. while you're in quarantine. Because if you're staying put like you're supposed to, that is the incubation period. It's from your date of last exposure. So if I am positive and I have infected Sheila, or exposed Sheila, excuse me. I'm infected, I exposed Sheila. Well, today's our last day of contact. I'm gonna go into isolation. She's gonna go into quarantine for 14 days in the hopes that our exposure did not actually transmit the virus, but it could take up to 14 days for that virus symptoms to show themselves. So even if Sheila got a test, that's good to know if she's positive or not, but it does not adjust her quarantine period unless she became positive, and then she goes into isolation.
And have we gotten any federal money to help with this program that we're running?
So some of the money that we get through our public health preparedness and this new epidemiology and laboratory capacity funding is federal funds for the health department. Now, there may be other opportunities. I don't know about the FEMA and things like that.
Thank you.
Legislator Petrus and then Legislator Vitale.
Thank you. With regard to the children in the schools, I apologize if you don't know the answer to this, but you're the.
That's all right.
So-
I'll get the answer if I can get it.
Yeah.
That's all right.
So I'm just curious if there's any credence that's given to this in regard to the children returning if they leave school. Is there any credence that's given to the symptoms with which they're presenting? So, you know, like possibly if you have a knee injury, because if you're fortunate enough to participate in one of the sports that the regime is allowing. So like if you present with a knee injury, do you have to have a COVID test to return? Or is it just, if you leave school feeling infirmed, you now have to have a COVID
It
test?
should be COVID-like symptoms. So a knee injury would not be COVID-like symptoms.
So
So
just-
that should not require those stipulations.
Respiratory issues?
Respiratory issue would be a COVID-like symptom.
My question is also related to the schools. And, if you have any children in school, always say they have a toothache. Don't say they. But a lot of parts of the states have rapid testing, and I don't think we do in Cayuga County. I think the school of Onondaga County has some, but when a student has a symptom, they're taken out, and then they're wait 3 to 5 days for the really tough on the kids, and it's tough on the education system. Is there any chance that we're gonna get any rapid testing in this area? Or are we just non-existent to whoever it matters to?
So I know that our chairwoman has advocated specifically for rapid testing, and we certainly have to. We're open to any testing right now, let's be honest. We'll take it even if it takes a few days. And the upstate would probably take about 24 hours if we're able to. This is quick, but it's not the rapid test. Within our county, I'm not aware of rapid tests except if you're in the hospital right now, and then they prioritize how they apply that because there's a limited supply. Do we want that? Absolutely. It would be wonderful to have that for all sorts of reasons within our community.
Legislator Daley.
Just to clarify, if we have an arrangement with Upstate to come into Cayuga County once a week, would it be the saliva testing that they're offering to the Onondaga County school-age children and teachers? Or is it the nasopharyngeal?
It's nasopharyngeal. I did ask that question, and we're hoping that we are hoping that Onondaga County will be able to expand their options for saliva testing that is being offered at the NPR Stadium, because we would like to be able to allow for Cayuga County students and teachers to go there for that.
Is the saliva testing a much rapid return, positive or negative?
I can't tell you. I don't know how they do that. I know right now from what our physicians who read the research in this area are telling us, and then what I'm hearing on our phone calls, the nasopharyngeal is still the most accurate.
We'll do Legislator Foley.
Yeah, just one quick question. I've heard from different parents that they're under the understanding from schools that if your kid has one symptom, that they get sent home. And so when you think, and I don't know if that's accurate or not, but if it is accurate, when you say the amount of kids that in the wintertime just have a runny nose, for instance, or I don't know, cough, right? I mean, that seems pretty burdensome overall, and is that the case? Is that accurate? Just so
I agree with everything you said. It is pretty burdensome, and it is a challenge, and it will continue to be so until we get some changes. Yeah. And related to that, I would say flu season is upon us, and flu shots are available. And because the symptoms are so very similar, more than ever, we want to encourage people to get their flu shots. And some of you may have seen an email that went out from our department today. We are being mandated to do a drill under our public health preparedness grant deliverables, which of course couldn't be a worse time, right? But in some ways it's fine because we can use this as a delivery method for flu vaccine. And we're making it available. The government, that is a real positive. The federal government is saying, we have our vaccine for adult program, that any adult can get their flu vaccine at no charge through the vaccine for adult program, or if they don't have insurance that covers it. So you have insurance maybe to go to the doctor, but you don't get it to cover your flu shot. Well, the VFA can be used for you to get a flu shot at no charge to you this year. That probably won't continue, but it is this year, so we want to encourage it. And the intent of having this drill is to prepare us for the idea of having some sort of a vaccine for COVID-19.
Okay, we're going to do legislator Lattimore, and then we'll go back to Petrus.
Kathleen, how many contracted cases do we have and how many deaths from COVID do we have, actual deaths?
When I left the office this evening, I take that back, that won't be accurate. Yesterday evening, we had 11 positive cases currently. We sent out the press release yesterday. It was 193, maybe 194, and we've had 3 deaths.
Legislator Petrus?
Thank you. I'm just curious, I don't know what data you're capturing, or if even you can reveal this, it might be like HIPAA or something like that, so I will take it personal. Of the positive cases, how many are asymptomatic?
I don't know that,
Okay.
actually. We would have to look into each case. There certainly are some people who've been asymptomatic that were identified in like preoperative screening.
Thank you.
Any other questions for Kathleen Cuddy? I appreciate you giving an update today to let us know. As we all understand, we've been through this pandemic, and just when we think we have the lay of the land, something else happens, and it's just been quite a ride. But thank you for all the communication this week, and we will be continuing that.
Very good. Thank you.
Thank you.
Okay, minutes to approve, August 25th, 2020.
Move them.
Second. Appointments and reappointments.
Can we get an all in favor on those?
Oh.
The minutes?
All in favor for the minutes?
Aye. Okay, appointments and reappointments.
Move it.
Second.
All in favor?
All in favor? Sorry.
Aye.
I thought you-
Now, you read the title.
Sure, thanks.
We have emergency resolution, it's resolution number 289-20, authorizing the superintendent of buildings and grounds to allow
Kwasniewski?
services to replace sections of a failed sewer line serving the courthouse. This was signed and approved.
So,
Yeah, that's, is that right?
This is resolution 289-2.
Cool, yeah.
So we're on
Oh, yeah.
I was thinking for the
289-20, it's for the Pitney Bowes lease agreement. I think it was mistyped below it. She was reading one here and it goes right to the sewer replacement.
Oh, gotcha.
So the emergency resolution is for the Board of Elections Pitney Bowes lease agreement, authorizing the chair of the legislature and the commissioners of the Board of Election to establish lease agreements with Pitney Bowes Credit Corporation for mail equipment located within the Board of Elections. Can I get a motion? Or no, we passed this, we signed it.
Yeah.
Sorry, excuse me. For informational purposes at this point. Okay, your turn.
Communications and announcements.
Wait the reader.
Second.
All in favor?
Aye.
Dr. Durant is not available today, so we're going to move forward. I will contact him to get an update. We don't have a report right now. Up next, we have committee reports and individual legislators' reports. Any new reports? We're going to start with Mr. Batman. We'll move to Mr. Foley.
Yes, thank you. I just have an announcement that's a very positive announcement. Even though the 2020 class for the Women's Hall of Fame, the induction has been delayed because of COVID, they're planning ahead. And it was announced September 9th that Emily Howland will be inducted as an honoree in the Hall of Fame in the 2021 class. And I just wanted to read in the letter that was received by Maryland Post and submitted the nomination. The response indicates that it says that the recognition, recognizing her achievements in establishing and supporting schools to educate African Americans and 50 years of participating in the suffrage movement, including convincing Ezra Cornell that Cornell University should be co-education, which actually I didn't know. It's a pretty great accomplishment. Emily Holland, as people may know, lived in Sherwood, New York, and Scipio. And it's been said she is the most overlooked and underappreciated figure in the suffrage movement. So after all of these years, it's just great that she's going to be recognized. So we can all be very proud of her. And she joins other esteemed Cayuga County residents in this honor.
Thank you very much for sharing that this evening. Legislator Foley.
Yeah, okay, so, try to be quick. IT work group has been meeting. So one of the issues that we've been discussing is I've heard several complaints from legislators regarding their tablet use and they're not functioning properly. So to try to get a better hold on that, we came up with a poll feedback system that we'll send through email that asks you general questions like, what are you what's your issues with it? How long do you use it for? Would an iPad possibly be better? So please be on the lookout for that to help IT better understand from a holistic viewpoint of how they can help the legislature.
Could you print one, please?
I can get you to print it out. Secondly is we want to solicit we have an impending 2021 contract with our entree team. And in order to help the group understand how IT has been performing, we are going to send out a poll to department heads, soliciting feedback, and to understand how they interact with IT, what they think can happen better, what has been working wonderfully, and go from there. And so that's being done, I believe, by Lisa Flipple. She's sending it out, but it was formulated by Trish and myself and some of the other people on IT work. So that's two. The third item is the copier printer contract that we've been looking at. As people know, our contract is running out. So we looked at proposals. One was from Xerox, one was from Toshiba. The county IT staff, Brian Lamb, Paul Borgman, as well as other people in that group, Lynn Marinelli, Don Carr, were all very helpful in assessing that. As of last week, a couple weeks ago, for government operations, they still needed more time to assess those findings, gather information. We again met on Friday. They agreed as county staff that they needed additional time. And they said hopefully they would be able to have a full resolution by government operations in October. And they're a wonderful group to work with, and their eyes, or their expert eyes are on it, and really hammering it out and asking a lot of good questions. So, they'll come up in October. Thank you, Madam Chair.
Great, thank you, Mr. Foley. And I was able to join the steering committee last Friday. I appreciate sitting in on that discussion. There's a lot of really great discussions, things I didn't ever think about. Certainly I'm here on the sixth floor working, but it's nice to hear from some end users that were in the room about the rate of copying and what's actually useful, what they kind of envision moving forward. So I thought that was really great. So, but thank you for all of your hard work with the steering committee.
Yeah, and thank you for coming. They did do a presentation, and it was really helpful. We'll likely have them provide the same presentation as government operations for any legislators who have questions. Every legislator was also welcome to attend any of the IT work group meetings. So yeah, thank you.
Great. Legislator Lattimore?
Madam Chairman, I apologize to Chairman Foley in regards to the Ways and Means meeting. I had indicated that I think that particular contract over the life of the contract was going to be $150,000 savings. I think it's more like 125. So apologize for that. But I do think it's a worthy effort. I believe that Xerox and Toshiba are two fine companies, but I think that as the resolution was proposed by Paul, and I got criticized for asking the question as to who pulled the resolution with Xerox. And I'd like to have Rich explain what my role is in regards to being on government operations, whether or not I have the ability to question the operations of my committee or that I'm a member of, or do I just complain about at the end, or can I investigate it on my own in regards to like kind and quality and how the contracts in the past have performed, so on and so forth.
Well, it's an interesting question. I think in general, as a legislator, you have the right to investigate the business that's before the board and to gather information and et cetera. As far as the operation of a given committee, each chair has the ability to, as the chair of the full board, has the final decision in terms of the order of the meeting and how the meeting is going to be conducted. So I think your question kind of hits on both tangents.
So as a legislator and a board member of that particular board, I have every right to ask questions in regards to how, where, what, when, performance, what have you, or am I improper with my question?
In general, it is not improper for you to ask a question as far as, gathering information, data, and et cetera, in order to inform whatever vote you're going to make on a particular issue. But like I say, in terms of how the meeting is run, the meeting is run by the chair.
Well, I think
so. The answer to your question is yes to both questions, but
I think my
without
question
getting
in
into
the past on different contracts has resulted in maybe a surplus in the millions of dollars, and I'd like to thank my I'm on the health committee too, and Elaine did some research on some of her stuff and came up with millions of dollars of savings. So I think questioning is a good thing, and I apologize again for Mr. Foley. I misspoke when I said 150 over the contract length. It's more like 125. I hope you accept my apology.
I look forward to the presentation of government ops.
Pardon, ma'am?
I look forward to the presentation of government ops on the contract.
Still can't hear you with the mask.
That's the way it is. Legislator Kerr.
I just want to remind everyone about the census. It is going on through September 30th. So please continue to promote it in your communities and people that you're talking to. I have some signs here. I would like everybody to take 2 with you and stick them up in areas in your district where they're visible. Either be a public place or a crossroads that gets high traffic. That would be super helpful. We have also some bags here for promotion that you guys can take and distribute as well. There'll be a lot of digital advertising coming out, I think starting tomorrow on that. So we're running out of time, but last ditch push to get the response rates up is appreciated.
Legislator Kerr, I love your style. She's got the signs right here. No one's leaving here without signs, clearly. So thank you very much. Legislator Vitale.
Just a question, I don't know, Legislator Kerr can answer it or somebody else can answer it. With the population in New York City dropping the last few months, do people have to like redo their census if they move out of the city, or?
You want to respond to where you were living April 1st.
I'll go back to April 1st.
Yeah.
Thank you.
Legislator Lattimore, and then Legislator Daley.
I don't know whose idea it was on the census, but I filled mine out in front of this building, waiting to do some DMV. That was a nice thing to get maybe a population that it's tough to capture.
They've been in front of this building a couple of times, I think, the U.S. Census Bureau reps. I know Sue's been asking for them out there as well. So any spots where we can table in the next, 7 days or so, let us know. We can get Census Bureau reps out anywhere to do mobile response. So yeah, we want to saturate those areas where there's high traffic for sure.
Legislator Daley.
I just wanted to confirm, I've already completed my census, but the deadline is the end of this month.
Yes,
No one can put any additional data in after September 30th.
that's it. It's potentially there's a court case right now, but that's it for right now. September 30th.
Do you know whereabouts, Legislator Kerr, where we are in terms of our response rate?
We're at about 60% for the
60%,
county, I want to say. We actually were just looking at these numbers over the last month. We've gained a little bit in positioning within the region for our self-response rate, which is good. But there's other counties around us that have higher rates, and we want to be, we want to keep pushing hard to get that up. Certain areas of the county are definitely undercounted. So again, the rural areas, Sterling, Niles, those are 2 very low response areas. Ledyard as well, some of the areas with low, not great internet access.
Okay.
West side of the city, etc.
Great.
Yep.
Legislator Petrus, question?
Thank you, Madam Chair. I just had another question for Legislator Kerr. Hopefully, I know I'm jumping the gun here a little bit, but anxiously awaiting the data for the purposes of redistricting, and I was curious if you knew when we could anticipate that.
The final count goes to the president by the end of the year, December 31st, and I believe those numbers come through to us in March or April
March of
next
2021?
next year. year.
Outstanding.
I'll double check that, but that's from my recollection, yes.
Thank you.
Mr. Petrus, thanks for dusting off that redistricting conversation. That's great, thank you. Any other legislative reports or committee reports? Legislator Lattimore?
I was at a flag raising for Avstar Fuel Systems, down on Garfield. And, they're doing some additions. They're a manufacturer of jet fuel systems and very high tech, owned by Ron Uyghur. They're doing an expansion, which is nice. Tracy was there. We need more of it. Exclusive Lazy Golden Egg is manufactured. Pays these bills, for copiers. Thank you.
Thank you. Any other reports? Okay, I'm going to give the chair report. I have a few notes here. I've been participating in budget meetings all month, and we have a few more to finish up this week into next. So this has been keeping us very busy. It's been great to see in depth the budget and have the conversations around how our departments are doing and see their ideas for next year. And we will continue this process moving forward. We have established search committees for both highway and EMO. Our HR administrator, Lisa Lippold, is reaching out to you if she hasn't already to join at least the highways first, I believe, and then the EMO search committee will be following. So please look for that update. I have populated the committee to discuss leadership in the county, and I have asked our department head, Steve Lynch, to facilitate these conversations with legislature. He's going to be, he and I will both reach out to folks who have offered to give up their time to discuss this. We're hoping to have our first meeting the first week of October. So please look for that email. We'll get something out to you tomorrow. Most of the people who indicated interest are on that list, so it was a handful. So certainly didn't want to meet a quorum for that, but I'm happy about the interest in that. So those are three things that are keeping us busy. In addition to budget meetings, I've been a part of some building meetings with Sue Dwyer and the sheriff, and all discussions about how we have public moving through the DMV, talking about some space issues for serving populations needing to come and see DSS or to drop off various items to various departments here in the building. So we're trying to streamline this process and trying to maximize space wherever possible. We are going to be interviewing health screeners. They're going to initially screen employees coming through the back door in the basement daily. So we are going to be working on that. They're already set up for the next couple weeks. In addition, I'm going to be coming to this body with some quotes on screening technology to be stationed at the front door. We talked about possibly having a health screener in person at the front door. And then we looked further into some equipment and technology. There are some fairly cost-effective options, so I'd like to bring an option or two to this body to consider. Right now, I'm going to thank the sheriff's office for allowing our security staff to do some screening for some public that are coming into the building and getting on the elevator. Those are very few numbers of folks here for depositions or for specific meetings. But as we continue to welcome the public through the DMV, as well as into other parts of the building as we open up, I feel the equipment would be the best way to screen and keep everyone safe. So we'll talk over some of those options with this body through the next month. Let's see. Okay, and I wanted to add to Kathleen's report. Clearly, I've been very busy with the regional control group. I've had many calls and questions about back to school, preparedness, what to do when their kids are sick, all the same questions. I think they call both of us, or me, then you, or vice versa. The big push right now, the nursing home visits, as Kathleen had pointed out, the policy in place is the negative test every 7 days to go see a loved one in the nursing home. I have received countless calls on this. This is a major issue. I have talked with state reps about this. I'm talking to our regional control group leaders. I understand the policy in keeping that population safe, but clearly what was missed was some sort of agreement with insurance companies. And we cannot ask our residents to pay $100 to upwards to $500 for a negative COVID test to check on their aging adult in a nursing facility. So as I said to the state, this is a crime, it needs to be rectified. So we've been pushing very hard on behalf of the residents of this county to provide affordable options. We'd love to we're trying to work with them to get the state testing site set up in this county. We're working on securing rapid tests wherever possible. But in the meantime, we're looking for upstate to help us directly. So we're examining all kinds of options. This is something that's definitely, at this point, I'm very confused by it. I think it's very unsettling. And we're talking about, once a week, folks having for one visit. And if you've ever had a loved one in a facility, as I have, you visit daily or multiple times a day. And so it's very heart-wrenching to hear the stories that I'm hearing. So we're working as hard as we can on that. I continue to process the snow and ice contract that has been pulled from today's agenda. That will be answered in the next few days, and then we will discuss through the next cycle. But that has been brought up to the state, and they are going to give us an answer about what was discussed, which was a 1-year extension on that. So I'll let you know how that goes. Last but not least, this is Legislator Ripley's last legislative meeting. As you know, Legislator Charlie Ripley has resigned from the legislature. I would like to honor Mr. Ripley for his service to the legislature. I will tell you, you'd be hard-pressed to find a more dedicated public servant. Charlie has worked hard for all of Cayuga County and is continuing his public service by returning to his home district to fill the seat of supervisor in Summerhill. So we wish you well, Charlie, and I want to ask you all to help me honor him today. Thank you.
Chairman, I'd just add that Mr. Ripley and I, and along with Mr. Chris Palermo, went to Syracuse, and we found how to buy rock salt, and putting the backbone of the internet through his town, he's improved it 1,000%, and hopefully we can build the rest of the spine through the county so that if anything like this pandemic happens again, we can go virtual if we have to. But Charlie, you're a man, a Marine. You've done a good job, Mr. Thank you.
Thank you, Mr. Lattimore. Thank you, Mr. Ripley. And that concludes my report. Do you have questions for me this evening?
Madam Chairman, I got, you indicated to me that you weren't going to make any reappointments during this time. I know that the Power Agency's been looking for a couple for months. Are you going to make those reappointments or that appointment?
There was an appointment made this evening to replace me.
I can't hear you.
There was an appointment made this evening to replace me on the tourism board. So Heidi Nightingale's agreed to take my place on the tourism board. So that's why we put her in short order. I certainly was not able to dedicate the time that I wanted to the tourism board.
And also, Madam Chairman, I happen to be with some leadership in Onondaga County, and they're looking at a big opportunity now. And I think it is a golden opportunity for our economic development people to try to bring back some of that Chinese manufacturing that's over there now. With Tessie is a perfect example of what we can do. And I'd still like to push for exit 40. I know that Chris has asked for joint meeting between the Power Agency and CDC. And I'd like to see that happen in my lifetime. So if you could expedite that, I'd appreciate it.
You would like me to expedite?
Pardon?
You would like me to expedite that?
Well, I think as a leader, yeah.
I haven't been approached about
Wait.
any project or setting up any meetings. So if I am, I will be doing so.
Well, I know that Onondaga County is doing some heavy research in regards to economic development. I think it's a good opportunity for us to look into. Thank you.
Any other questions? I wanted to point out, normally we have our employee recognition. It's usually a lunch, and we usually are all together and having great conversation. And unfortunately this year, it's been kind of a sad way to celebrate this. But I know that we've sent some certificates to department heads to give to any employees in their departments who need to be recognized. And here is the list in front of us, if you can see all of these names. I wanted to call out some of these names for folks that have been serving for 25 years and more. So I'm going to start with the 25-year recognition for these Cayuga County employees. For 25 years, we have John Buhlman, Thomas Carbonaro, Angela Criazzo, thank you, Stephen House, Joanna Labisco Mancuso, George Scott, Christopher Stevens, Gregory Trussell, Brian Turner, Lori Updike, and Bruce Watkins Jr. For 30 years, we have Christine Bianco and Diane Valentine. For 35 years, we have William Bennett. For 40 years, we have Linda Carr. And for 45 years, we have Karen Dwyer. So if we can give a round of applause for all of these. We thank them for their service, and we thank all the employees, especially this year. It's been difficult, and everyone's been doing more with less and pulling their weight, so I appreciate everyone. Okay, with that, we're going to get to resolutions. We're going to begin with Ways and Means with Mr. Petras.
Thank you, Madam Chair. Ways and Means has one resolution authorizing the purchase of tax delinquent property owned by Cayuga County.
Move it. Second.
Discussion. All in favor?
Aye.
Opposed? Carried. Thank you. Health and Human Services Legislator Daley.
Yep, Health and Human Services had 13 resolutions. As you can see, HH3 was tabled at the Health and Human Services Committee. HH10 was amended at the Ways and Means Committee, and HH11 was pulled at Ways and Means. They have gone through both committees, asking to bundle HH1 through HH13, unless anyone wants any of them separated out. I had a lengthy discussion at Ways and Means about a number of these.
Move it. Second. You're excluding HH3, which is tabled.
I said HH3 was tabled.
Motion said.
Oh, well, bundle them all except those tabled, yes.
I'll move all the ones that aren't tabled.
Or pull.
Thank you.
And had a second?
Aye.
Okay. Any discussion on these as a bundle? All in favor?
Aye.
Opposed? Carried. Thank you very much. Okay, legislator Foley, government ops.
Madam Chair, Government Operations has 7 resolutions on this poll, so we'll have 6. I'll offer them, they all pass both Geo and Ways and Means, so I'll offer them up as a bundle and somebody wants to single it out.
Move on.
Second.
Okay, any discussion on these? All in favor? Opposed? Anyone opposition? Carried, thank you. Okay, no planning or public works. Judicial public safety, Mr. Petcher.
We have 4 resolutions, they've all been passed by committee, have been through committee, and I'd like to offer them as a bundle, 1 through 4.
Can we separate 4, please?
Okay, 1 through 3, please.
Second.
Okay, discussion on 1 through 3. All in favor?
Aye.
Opposed? Carried, thank you.
JP 4. Move that.
Second.
Discussion. Hearing none, all in favor? Opposed?
Opposed.
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 Who's the last one?
Dennison, Lattimore, and Whitman.
Okay, carried, thank you. Motion to adjourn second. All right, all in favor?
Aye.
All right, thank you for joining us this evening, and thank you for joining us online this evening.
Thank you.
Yeah.